Hello and welcome to OffBlueMedical. Today we will discuss 10 more quick notes for the USMLE. So the first note is regarding mild lymphoma. And this, you have to know, is the only malignancy that can be cured with antibiotics using triple therapy to eradicate H. pylori. So as you know, mild lymphoma is a rare type of non-Hodgkin lymphoma, which if it's left untreated can progress to metaplasia, dysplasia, and eventually leading to gastric cancer. So the diagnosis for the USMLE is through endoscopic biopsy. And for all patients, you have to test for H. pylori because 90% of these cases are associated with H. pylori. And if a patient has advanced mild lymphoma or if they have an H. pylori negative tumor, antibiotics are not going to be enough. So you should use something else, such as radiation therapy, immunotherapy, or chemotherapy. The second note is about esophageal cancer. And esophageal cancer metastasizes unusually early because the esophagus lacks a serosa. So it's going to metastasize unusually early. And you also have to know that there are two types of esophageal cancer. The first one is squamous cell carcinoma, which is the most common worldwide. It occurs in the upper and middle third of esophagus. And the risk factors include chronic use of alcohol and tobacco. This is the first type. So the first type is squamous cell carcinoma. It occurs in the upper and middle third of esophagus and it's associated with alcohol and smoking. While adenocarcinoma, this occurs in America typically. So adenocarcinoma starts with A, so America also starts with an A. So adenocarcinoma occurs in America and this occurs in the lower third as opposed to squamous cell carcinoma, which occurs in the middle and upper thirds. And adenocarcinoma is associated with obesity and gastroesophageal reflux disease. So patients with gastroesophageal reflux disease, especially long-standing, can develop Barrett esophagus, and Barrett esophagus can lead to adenocarcinoma of the esophagus. And the most high-yield word on a question is going to be progressive dysphagia, where a patient initially experiences difficulty swallowing solid foods, which eventually progresses to difficulty swallowing liquids. And of course, it can also present with significant weight loss, odynophagia, meaning pain with swallowing, worsening reflux, gastrointestinal bleeding, vomiting, and for the USMLE, if you see presence of hoarseness, this means that the tumor is non-resectable. The third note is that you have to know that diverticulitis pain often varies by ethnicity. So in Western populations and in America and other Western populations, it typically presents in the left lower quadrant, whereas in Asian populations, it frequently manifests as right lower quadrant or suprapubic pain. So it can mimic other conditions such as appendicitis. So this shift is primarily due to the higher prevalence of right-sided diverticula and those of Asian descent. But in general, for the USMLE, it usually presents in the left lower quadrant. Carcinoid syndrome can lead to pellagra, which is niacin or vitamin B3 deficiency. So you have to know that both serotonin and niacin, which is vitamin B3, both of them are synthesized from tryptophan. So if we have a cancer of serotonin, a tumor of serotonin that produces serotonin, then we're not going to be able to produce niacin. So that's going to lead to niacin deficiency. So I have to know that the tumor of serotonin, which is the carcinoid syndrome, is going to divert all tryptophan to mass produce serotonin. So there's going to be no tryptophan left to produce vitamin B3. This is going to lead to vitamin B3 deficiency or niacin deficiency or the name pellagra, which presents with the 4Ds, which is dermatitis, dementia, diarrhea, and death. Dermatitis has symmetric dry hyperpigmented skin lesions, dementia and watery diarrhea, and death. For myocardial infarctions for the USMLE, you have to know that menstruating women virtually never have myocardial infarctions, especially if they have no other risk factors such as a family history of premature coronary artery disease. So if a question brings up maybe a 25 years old female and one of the answer choices is a myocardial infarction as a diagnosis and they have no other risk factors, then it's most likely incorrect. Hyponatremia, and this is very important, you have to know that hyponatremia is an independent predictor of mortality in patients with heart failure as sodium levels directly parallel the severity of the disease. So the lower the sodium level is, the worse the prognosis is. And this is very important for the USMLE. Sexual abuse in infants, a vaginal culture positive for Neisseria gonorrhea is definitive evidence of sexual abuse, but chlamydia is not, because it can be acquired from the mother during delivery and persist in the child for up to 3 years. But Neisseria, no, this is going to be sexual abuse. And also, regarding abuse in children, you have to know that osteogenesis imperfecta, which is a disease, this is a major mimicker of child abuse due to the presentation of skeletal anomalies, easily fractured bones, and bruising. So children can come out with fractured bones and bruising, and it can be hard to differentiate between osteogenesis imperfecta and child abuse. So you have to take care in differentiating between these two. Turner syndrome, you have to know that the most common cardiac anomaly in Turner syndrome is a bicuspid aortic valve, even though aortic coarctation is the most famously tested association. So patients with Turner syndrome also present with short stature and primary amenorrhea. And this is very important. Primary amenorrhea, meaning they don't even develop periods, menstrual cycles. They don't get menstrual cycles from the start. And streak ovaries, and this is also important, that meaning underdeveloped ovaries. And of course, the underdeveloped ovaries can also lead to cancer, so we can remove them prophylactically. And another classic presentation in the neonatal period is cystic hygromas and congenital lymphedema, and this is going to present as puffiness over the dorsum of the infant's hands and feet. And patients with Turner syndrome require baseline renal ultrasounds because they are at a high risk for genitourinary problems such as horseshoe kidney or fused kidneys. And you also have to know that for the USMLE, Turner syndrome is associated with autoimmune diseases such as primary hypothyroidism, Hashimoto's thyroiditis, and celiac disease. And lastly, you have to know that for hormone levels, when you are evaluating a patient for hyperandrogenism, if you see just an elevated testosterone with normal dehydroepiandrosterone sulfate levels, this means that the testosterone that is elevated is coming from the ovaries. Whereas if you see elevated DHEAS levels, this means it's coming from the adrenal glands. So my tip, when you see elevated DHEAS, that means it's from the adrenal gland. So ovarian sources, as I said, if you see an elevated testosterone with normal DHEAS levels, this means it comes from the ovaries, such as polycystic ovarian syndrome, Sertoli Leydig cell tumors, ovarian hypertrichosis, which is similar to PCOS in older women, lutiomas of pregnancy, and theca lutein cysts. You have to put these differential diagnoses in your mind. And regarding the adrenal sources, you have to put adrenal tumors, congenital adrenal hyperplasia, and Cushing syndrome as differential diagnoses in your mind.